Yeah.
All right, let's call the meeting to order. We can all stand for the pledge.
Yeah.
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, you doing? All right, everybody's had an opportunity to review the minutes from the last meeting. Can I get a motion?
So approved.
Second, all in favor?
Aye.
Okay, we have one resolution for today from 911. Yes, one. Yes.
So this is the monetary portion of the MOU that I asked for approval last month. I need to have the money to be able to spend, so that way Jefferson can reimburse us. So asking for a budgetary modification to move money from fund balance $185,000 to the 911 other equipment budget line, so I have enough money to purchase the equipment, so we get the first half of that taken care of, and then Jefferson will reimburse us for that total amount that's spent. And they will be reimbursed from the grant.
Your motion?
So moved.
Second?
Second?
Any discussion? All in favor?
Aye.
Aye. Any opposed? None? Thank you very much. Okay, let's move on to committee reports. Public safety EMO. Let's start with you, quick.
Good morning, thank you. So first I just want to say thanks you to the committee and legislature for approving our new EMS coordinator position. I wanted to welcome, we brought Nate Deere here today. He's our new EMS coordinator. He's already begun some of those initiatives that we talked about that was the reasoning why we wanted this new position. So I'd like you all to welcome him, and we appreciate him coming today to meet you guys.
Welcome
to
Nate.
our family.
Thank you.
So as for EMO, we do continue to support the COVID-19 response. We're still working through the test kit distribution to the fire departments. There's still approximately 7 drive-throughs left. I have dates and times if anyone needs to know. The majority of the test kits have been distributed to most of them. They're now looking for potentially having additional drive-through sites if they still have remaining test kits, or they're trying to get them out to the community through their libraries or other community initiatives. Like they're going to do some like chicken barbecues at some of their stations, so they're going to give them out during like Renee and I came up with a fish and a kit, Fish Fry Friday and a kit.
Fish and a kit.
Yeah, anything like that. So, they're just trying to get them out into their communities as well, and who better to do it than the fire departments from those districts. So, they're still working through that. Sandy Creek hasn't had theirs yet, so they've got some dates coming up. I think there's 3 dates coming up. They're all in March. So that's where we're at with that. We're working through another distribution plan for some additional test kits we got. We were notified by the state last week that they were sending out additional test kits to all the skilled nursing facilities as well as the adult care facilities and schools. We're going to be getting more test kits coming up too. There's been no indication whether we would get another distribution yet, but generally they get through those distributions, and if they have anything left over, they sometimes send us some. So that's the status of test kit distributions right now. What else? We did have a retirement in our office. We had a nurse on campus that finished up last week. We will be looking to replace that position, something that we utilize quite heavily, especially during drill times and exercises. We do have the drone coordinator in place now too. He did give me a report of, he's been in place for 2 weeks now. That's John McGraw. I'm not sure if you guys have met him yet. If not, I talked to Mark and we talked about potentially bringing him down to do a presentation. So we'll give you guys more information. So we can talk more on that at a later date.
Yeah, just real quick, would anybody be opposed to meeting at emergency management at the next meeting?
I think it's a good idea. I'd like us to be meeting at different places, even the
So,
trips.
all right, so we'll convene at our next meeting at emergency management office.
We'll make sure we have a flag.
Good idea.
Okay. So yeah, we'd like to have him do a little presentation just so you guys can get to know him as well as get to know more about what his initiatives are and what he's working on, and then it's a good opportunity too. With that, some of the things that he's working on right now, just to give you a quick overview, is he's working on getting live streaming capabilities, so your incident command can see what the drone coverage as well as anyone else who's working with the incident. So that's something that the Sheriff's Department, I believe, is working to do that. Oswego City and Oswego Fire have that capabilities already, so that's one thing we're working on. He's also working with Leanne West to see if there's any grant opportunities to buy additional drone equipment, because some of our equipment is a little outdated or doesn't have limited capabilities, so we're trying to increase that capabilities. I'm working with the sheriff's drone pilot to do some necessary flight logs, helping that administration side of it. So those are some things he's been working on. He's only been in the office since February 14th. Any questions on any of that stuff?
Yes.
Go right ahead.
Between you and Phil, if we're looking for new equipment for the benefit of those drones benefit everybody, would we able to get some of that in the ARPA fund? So if you can't get a grant, we at least can.
He is working with Dave Turner as well in that to get a proposal together for that. So he put something together last week. I looked it over a little bit. He's going to send it to Dave to see if he wants to flesh it out some more. Dave will ask additional questions. So we are looking at that route too.
All right, one more quick question. Your typist, would he or she a senior employee? Or how many years?
Oh, 13 years with EMO, but with the county and different departments more than that. She doesn't remember exactly how many she had, but she started with the health department. She's worked at DSS and she's worked at EMO for the last 13 months.
All right, so we should be able to save a little money on this with newer employee, correct?
This is Amy.
Yeah.
She's part-time,
Yeah.
so it's not a lot savings.
Yeah, but it's not gonna increase.
Yeah, no. Hopefully. I know Kevin has a part-time position. I don't know if this is anything we can ever do. I know that I think Terry Bennett in our department has a lot of tribal old knowledge. She said that one time that they used to be able to take 2 part-time positions, make 1 full-time position, and then offset it in 2 different departments. If that's an option, I mean, I know Kevin needs a part-time and I need a full-time.
That's how I started.
That's what she said. That's how I knew that she knew. That's how Phil started.
It's
Yeah.
possible to do.
Something to consider, because I know people are more apt to take full-time. Not everyone, but you're apt to get better opportunities with full-time positions than part-time, so something to consider. I mean,
Yeah.
we would work so closely. I know one in EMO.
There's got to be an agreement between, particularly in this instance, that, if you have an incident, even if that person is working for 911, they gotta leave.
Yeah.
Yeah, you can go to it.
Yeah, so that's what we're looking at from our department. Any other questions?
No, but I am going to jump out of order because we have Dr. Newpuff with us today, so I want to jump over to the sheriff and let him present, and then obviously interview Dr. Newpuff and discuss.
Dr. Newpuff's here today to explain the MAT program that we're another unfunded mandate from the state. Essentially what's happening here is the state in the next month here again is going to shut down another 6 state correctional facilities. One of those being Willard Drug Treatment Center. Prior to this, any state inmate that had a drug treatment or a drug addiction problem, they would be sent to Willard. So what the state is doing, and of course they did this with, they knew these shutdowns were coming, so they're mandating medical assisted treatment in the county facilities. So they're pushing it back on us now at the county level, statewide, that we have to provide drug treatment for inmates as opposed to waiting until they go to their state sentence. So with that being said, of course, there's going to be some staffing issues with this. We just don't have anybody. We're mandated to hire somebody to run this program. I'll let Dr. Newpuff is far above my expertise on the medical end of it. Let Dr. Newpuff explain what it's going to involve. And we're fortunate here that Dr. Newpuff is also the medical director for Farnham. So I can tell you that we're far and above any other county in the state. They're reaching out to us for advice on how to do it because we have Dr. Newpuff in a dual role. So for us, the expense is only being a staff member, LPN or RN, as opposed to other state or other counties in the state. They have to come up with paying for the drugs, a doctor to administer them, and the means of providing the treatment. We have all that here. We've had that since Dr. Newpuff was taken over. It was one of the reasons he agreed to take over, so that he could facilitate inmates that come in going from treatment there to when they're released. He's already hooked up with them and has them started on a program where they can become Farnham patients. If you could, Dr. Newpuff.
Just to clarify, I am not the medical director at Farnham any longer. I stepped down there, but I have a close association. Just to introduce myself, my name is Michael Newpuff. I'm a doctor of internal medicine. I've been in practice here in Oswego for a little over 40 years. I've tried to retire on about 5 times. I really thought I had made it this last time until about April of 2019, when I happened to talk to Christy Carrington of the legal department, who said that they hadn't had a doctor actually on site here for 3 years. So I came in, I met the sheriff, and the undersheriff was very impressed with what they wanted to try to do and volunteered my services to begin at that time. So I've been the medical director of the county jail here since April of 2019. I thought I'd provide you just a little bit of oversight of what's been happening to the medical care at the jail, and then provide you some more information specifically about the new MAT or MAP program. As we said, there was a nurse practitioner here for 3 years, but the doctor actually had retired and they were still using his license to be able to keep the medical facility open, although he hadn't attended. So there was a lot of things we needed to do at the beginning. We wrote a lot of policies and procedures. We hired some additional personnel. Since that time, we have had a fairly stable medical provider staff. We've had a difficult time trying to put together a stable and good nursing staff. As you probably know, registered nurses are extremely difficult to hire everywhere. And unfortunately, with the county's pay scale for registered nurses, we just haven't been able to hire anybody. The good news is we've been able to secure now 5 LPNs. And the LPNs that we have are very dedicated. They are really very good in what they do. There's some limitations, obviously, but they really worked out very well. And so we're lucky to have them, and I think they're providing good care. Over the last 3 years, this has probably been one of the most challenging jobs I've ever had. We've had 3 episodes of COVID. November of 2020, we had 2 this past year in 2021. We've learned a lot about how to try to manage COVID in a facility, and it is very difficult. The good news is we did not have any inmates who became seriously ill. Unfortunately, we did lose 1 correctional officer, as you probably know. We've learned a lot about how to manage COVID. We've tried lots of different approaches. We tried mass screening of people. And the problem there was it would always take 2 or 3 days to get the results back. So by the time we'd get the results, more people would have it spread. And we tried doing this last time, and it really did not work. The sheriff finally had to lock down everybody in place for a full 10 days to get through this last COVID outbreak. And again, fortunately, we did not have any inmate fatalities or serious illness. The big problems that we see in medical are definitely drug abuse and mental health issues. As you know, in this county, as in many counties, mental health services are woefully under-adequate. If you call up the new Lakeside Mental Health Facility, which is wonderful, it still takes you 6 months to get an appointment. 6 months. So we just don't get people in very easily. And COVID's only made this worse. There's a huge substance abuse problem in the county. So I'd say 60% of our inmates have combined drug abuse and mental health illness. And these are the 2 biggest problems that we deal with. Certainly we deal with lots of other problems, medical illnesses. Those of you who may or may not know, actually of this exact date, 2 years ago, we had an in-custody death. We were investigated by the New York State Department of Corrections. We replied to those. We changed some of our policies and procedures. And since that time, I think we've been stronger, better equipped to manage illness in the jail. Any questions so far about just general workings in the medical facility at the jail? I'll be happy to answer some questions, and then I'll talk more specifically about the MAP program.
Yeah, when you're Sheriff hit on it, their state is mandating more services being given by the county. what about in tents? Are we required also in tents, like Tully Hills, the intent inpatient type of services, or what do they want us to do? And I'm sure they're writing out checks like crazy to send it to us, you know.
Yes. They want us to do pretty much everything that is being done on the outside for mental health and for substance abuse treatment is what they really want. Paid for by the county, not by the state. We do have some individuals who we've been unable to manage mental health-wise, and we have had to send a few people to Rochester, where they have an inpatient forensic psychiatric facility at very high expense to the county. But for the most part, we've been able to manage pretty much everything else.
Well, you just mentioned it takes a long time to get an appointment to go to Lakeside.
It does.
You said
6 months is what they're
Well,
doing.
that's not acceptable. That's the problem.
I
Because
know.
you still have the people in the community I've got to put up with.
Correct. Yes. We need more mental health services. One of the issues that I was going to talk about with MAT is discharge planning. We provide discharge planning for every inmate when they're ready to go home. Where we fall short is in two areas. Number one, when judges release inmates without our knowledge and medical, and they are suddenly put out on the street with no discharge plan. And that happens. We would love to have at least 24 hours notice from a judge of when an inmate is being released so that we could plan for that individual to go home. The second problem we're woefully problemed is people who are homeless and discharged, released from the jail with nowhere to go. We provide them a bus ticket to get to social services, who puts them up in a motel with no supervision. That is just not working for us. The biggest reason we see recidivism is because of individuals with either no housing or unstable housing, and they relapse back into the same circumstances that got them there. It's unfortunate that we treat their mental health problems, we get them on medications, we stabilize them, we get them off their drugs. We keep them in jail for a period of time, and then suddenly we release them back on the street with no supervision, no housing, no follow-up, and expect them to remain citizens in again. That's a problem. We need some kind of halfway house, some kind of rehabilitation program for them to go to. There's kind of one in town that deals with women, and that's Christina's House of Hope.
Yeah.
And what they do is, it's basically tough love, rehabilitation, until they get from a time of being homeless to the time they can qualify for their own housing. But at least that individual, Shelley Spaziano, is doing a good job of helping them get into a medical doctor, helping them get on treatment, applying for Medicaid, making sure they're eligible for food stamps, learning how to cook and shop. These people don't even know how to go to a store and shop for themselves. That's the kind of facility we need in a bigger scale. Now, this is totally off but that's what we need. Because there's still, it's not a huge group. It's probably 5,000 people in the whole county that just continue to roam around with nowhere to go, no hope, no abilities to get better. And they're the ones that just keep getting back into trouble again. Part of the trouble really is when we went through bail reform. Bail reform to us has been a disaster because previously when people were incarcerated with their drug issues, we could get them into treatment programs like drug court and help them. Now with bail reform, we don't see them until they are brought in for warrants. They violate their parole, they don't come to their arraignment meeting, and so now they have a warrant for their arrest and they end up in jail and they have no ability to get sent to opiate court. So we've lost that ability. Individuals who are given appearance ticket are on drugs. We don't get a chance to treat those individuals anymore like we used to. They're sent out on the street, back into the drug scene again, and we don't see them until they finally show up for their warrant, their bench warrant arrest, or they're dead. And we're seeing that.
Well, you said that, you mentioned something right here, you said it off subject. It's not, because I'm tying up time with my sheriff or my jail. I get calls from constituents about these people walking around. You just can't go out and shoot them, unfortunately, because then I gotta bury them. You know, I mean, there's a lot involved here. And
It is.
and I hope the rest of the committee understands this is a big impact on our cost.
Indeed. Yeah, we've lost the ability to treat people early on because they're given an appearance ticket to show up for their arraignment, and we don't get that chance to intervene in their health care until they're finally arrested, and then they end up in our jail for 6 months. In the meantime, they're back on the street, committing crimes, using drugs. It hasn't worked. It's a great idea. We don't want to keep people in jail if they can't pay a bail. I understand that. But the concept needs to be tweaked and changed. You're right. Any other questions? Okay, so let me present some information specifically about the MAT program, Medication Assisted Treatment. What it's supposed to do is basically provide treatment for those individuals with substance abuse problems while they're in our capacity to treat them. There's about 5 parts of the bill for you to at least know about. Number 1 is we are supposed to continue treatment for those individuals who are already in a treatment program for their substance abuse when they come into the jail. In other words, if they're a patient at Farnham's and they're on treatment, we're supposed to continue that treatment while they're in the jail here until they get out again. And we're now doing that. And I think that's the right thing to do. If somebody were diabetic and they're on insulin, you wouldn't stop their insulin if they come into the jail. We think medication treatment should be the same way. And we're now doing that. The second issue is those people that have substance abuse problems for which there is prescribed medication to treat their problem, we have to give them the option of providing that treatment while they're incarcerated. That's a little bit more of a gray zone, because when we do drug testing on people when they come into the jail, which we do if they have any history of substance abuse, we do a drug analysis, a urinalysis. They don't have just opiates. They have 5 drugs in the urine. These people are doing everything, and opiates might be one of them. So do we put all those people on treatment while they're in the jail or not? And that's what we're still debating and how to work that in. The next part of the bill is we have to provide counseling for them. And that's going to be an issue because we don't have the ability to provide that counseling at this time. We're talking about 20% of our jail inmates who would be eligible for counseling, both individual and group counseling. We currently have 2 licensed social workers who do all of our mental health evaluation, treatments, assistance, and that's not enough. But to provide the counseling and the discharge planning, that's the next step. We have to provide discharge planning, meaning not only where they go when they leave here, providing assistance for insurance, providing housing for them if we can, and setting them up with a drug treatment program. That has to be part of discharge planning. What we hope is we can provide a part-time position, perhaps 20 hours a week as a part-time position, to do that inpatient incarceration counseling and discharge planning. I think that would be helpful. The next part is providing peer advocates. We need to provide some type of peer advocate for individuals with these substance abuse problems to get them to navigate their way when they leave here. And I think that is a very good idea also. I've already started talking to Farnham. Farnham would be willing to pay for that individual to come to the jail to provide that peer advocacy. So those are kind of the 5 parts of it. Continuing treatment for those individuals who are already in a program, discussing with that individual who has opioid dependency, whether they want to participate in the MAP program, peer advocacy, counseling, and then discharge planning. Those are the 5 parts. We have already started to try to initiate it. As Sheriff said, I was in Farnham for 3 years, became very familiar with opioid treatments, brought that into the jail. We have an opiate withdrawal protocol, we call it. Previously, treatment for opiate withdrawal was 2 rolls of toilet paper and come back in 3 days. I mean, that was basically it. Now we have a drug treatment program that helps them navigate through their withdrawal process. And for 90%, 95%, it's pretty adequate and they don't suffer much. So we've initiated that. We have treatment protocols for alcohol withdrawal, for other substances like Valium and benzodiazepines that's required. So we have all of those in place. We have the protocols in place for our treatment programs. There's still the concern of diversion. And I presented the information today of how resourceful some of these folks are in trying to help their fellow inmates. We just recently had an individual who was providing this medicine that we provide to him to another inmate by licking his mouth, licking a table, and then the other inmate coming and licking the table behind him. That's what these folks do. Okay. Besides that, that's what we do. That's what we deal with. They're an interesting group of people. So that's the MAT program. As Sheriff said, I think we've got a good handle on it. We'd be happy to help any other institutions try to get up to speed. It goes into effect October 1st. And so we've been trying it here. We have found that with the nursing care we have, we just don't have enough time and we're burning our nurses out. It takes at least an hour of a nurse's time to present this medication. We have to watch them so that they don't try to divert it. And on Saturday and Sunday, we only have 1 nurse on. At least during most of the time in the week, we have 2 nurses. But on Saturday and Sunday, there's only 1 nurse. So for that individual to make the rounds, take care of the new patients that come in, new inmates, and then provide medication is just way too much for people. So we are going to ask for additional nursing care help and a part-time counselor discharge planner for us to be able to do this program adequately. Anything that I can answer questions, I'll be happy to.
Does anything help? All this drug treatment stuff, have we been successful in any way?
Yes. The answer is yes, Mark. It's been shown that people are on treatment. 70% of those people remain on treatment. It's not 100%. We can't cure everybody. Without treatment, we know that 90% of people relapse. On treatment, 70% of people are successful. And at Farnham, when I was working with, 30% of those individuals got jobs, got their children back, could function in society. So we begin to think of it as a lifelong chronic illness. Just like somebody who has diabetes or high blood pressure, we can't cure those diseases, but we can control them with medicine. And I think opiate dependency is the same way. Only 10% of people can be cured without treatment, but 70% of people who are on treatment can be successful.
I think the doctor touched on it with opioid court and drug court were our most successful programs, but bail reform has just taken that away from us. We've completely lost it with bail reform. We have no opportunity to reach out to these people. And I'll say this, prior to Dr. Newpuff coming in, we had no treatment program. He's kidding around, but we literally would take somebody, lock them in a concrete cell with no mattress, a hole in the floor to flush the cell when they would defecate or vomit on themselves, and we would give them Gatorade and lock them in the cell until they went to the withdrawal. It was just horrific to watch. So, look, like I said, we're far ahead of most counties out there, with the exception of maybe Albany County. They're very progressive there. with their drug treatment program. But I just wanted to put this out, I wanted to have it on your radar because the discharge planner, that was mandated at least a year ago. That was supposed to be in place. We were able to fill that spot with the staff we had at the time. But going forward, this MAP program is just it's just another unfunded mandate being dumped on the county. So I wanted you to be aware of it. It's not until October, but it is going to be an additional cost to the county.
Sheriff, do you have room in the facility to handle this, or, take space to deal with these people? I get that.
Yeah, our population's getting back up there because what has happened with Valley Farm, everybody was cut loose, but now, as Dr. alluded to, nobody shows up on their warrants.
Yeah.
So eventually the bench warrants are issued. It just takes longer, so our population's climbing back up again. So, but we do have, there's still space in the facility, with the exception of females. That's always an issue. We have to, a couple of weeks ago, I think we were shipping some female inmates out to other facilities, other counties.
Legislator Stiglia.
Okay, don't get wrong with the question, okay, because I'm not in favor of any 99.9% of what Albany sends down here, okay? But will the treatment that we are doing and we are going to be required to do, is it equal to or better than the treatment that they would have received sending them somewhere else in the turnaround, be able to make them come back into society and be able to be a working member of the society?
The question, sir, is we don't know, because it hasn't been.
But that's just because
In Willard, they got 8 hours of counseling and treatment every day while they were there. They're not going to get that while they're here with us. So is it going to be as good as a Willard or an inpatient program? Probably not. But again, it's never been done, so I don't know.
that's right there is key to throwing it back to Albany. And I'm going a little bit off here, but we've written a lot of letters to Albany saying how we disagree with things. And a lot of them I don't agree with the letters, but this is something that is putting more cost back onto the taxpayers. And it's not going to be, and it's not because we don't have the people there to do it, okay? It's so we don't have the time to do it and the place to do it. This is something where we should send a letter, and we should get with other counties because it's going to affect them also, and say, look, you're being ludicrous. And they have been for a long time with closing down state facilities and throwing it back on the counties, and that's why our jails were getting overloaded, because we didn't have any place else to send them. And it's absolutely ludicrous what the state is doing to us here. And we've got to say something sooner or later, and I think we should. Thank you very much for your time, sir.
I can tell you that was the focus of the last Sheriff's Association conference, was much of this MAP program. As also Dr. alluded to, we have, John, what are we up to with inmates that were sent out to
Rochester?
Rochester?
Well, I believe there's 2 there and 2 on their way, so we don't have that budgeted for.
Cost.
It's over $1,000 a day.
Yeah, and that
We pay about $30,000 a
closing
month.
down mental health facilities.
What percentage of your inmates actually fall under this program?
We think it'll be about 15 to 20%.
And what does the state say? We're not raising your state taxes. No,
Right.
they're raising them the other way.
Right.
They're going in the back door instead of coming through the front door with us. And it's not right. Sorry, that's it. Thank you.
Any other questions for Dr. Newcomb?
Thank you very much.
Well, we appreciate you coming. Thank you for your service.
Thank you.
You're very welcome.
Appreciate it.
Okay. Well, any other questions for the sheriff then about anything else going on? Anything else, John, anything?
No, just that the patients that we do have going to Rochester, Greg, that's something I probably should check with you on.
Yeah.
I think we've got 4 now, and we don't have nowhere near that in our budget when we went through it, because we haven't had too many. All of a sudden, the last month, I think we've got 3 going. I got the list of names right here, which you can do with you after. We don't like them going there?
All right then, we'll go back to EMS where we left off. We're all good there.
I'll just highlight a couple of things. You see at the bottom of the report, some of the meetings, a couple of things that kind of tie in today with today's discussion. Oswego Health, that partnership call that we have. Recently, Oswego Health was on diversion for over 24 hours. Part of that was because their their facility was completely full. With their ER, 5 of those beds out of their 17 were psychiatric, pediatric patients that had no location to go. So now that they closed the pediatric center as well, they're seeing the backup in our ERs. So those individuals have no place to go. They're boarding in our ER until they can find a place, which is creating a backlog. So to go along with the discussion of it's across the board, it's pediatrics, it's adults. There is really a significant mental health crisis unfolding around us. The child fatality review team, I did bring this up to the fire coordinator across New York State, and within our own county, we've had a child fatality that related to house fire, where there were no working smoke detectors. So I did suggest to the child fatality team that if there was money in the budget, or if they had grant funding to create an initiative that perhaps we want to look at smoke detectors in homes and making those available. They used to be available through fire departments. American Red Cross is the only one right now that has that program available. So it's not unique to our county. They're seeing it in other counties as well. So Nate will be attending those meetings going forward, but hopefully if they get some grant funding, maybe we'll be able to see an initiative come out of that. So
I think a lot of the fire departments still do that program, so. I mean, it's gotten very, very expensive. I know our fire department, we've had to triple that budget line because the cost of the 10-year sealed ones are so much more expensive than what they were before. It's not the $5 smoke detectors anymore.
Right. And I think
Even our costs.
it's kind of hit or miss, and people aren't really sure, so like which part of your departments can potentially get them from. But there was a significant campaign a couple of years ago, Hear the Beep Where You Sleep. And so we're just seeing right now that seems to be a trend across New York State, is that we have individuals under 18 who are dying in house fires. So
I assume this was their residence that they owned and not a rental, right? Because rentals have to have them when they get inspected. Was this somebody's?
Our case was, I believe it was an old home,
Yeah.
but the other cases are not always owned homes.
In the sponsor code isn't really
Right.
in the townships. It's not like it is like in Fulton, Oswego, and bigger cities.
I'm just going to throw this out there. I had a house fire 7 years ago now. We had one smoke detector that was still going that woke us up. Very faint. So I'm a big fan of smoke detectors today, and wouldn't be here without it. So we got to do something to help get the word out on that.
So we put that out there. I mean, that's the whole intent of this team, is to look at what can we do to help prevent additional child fatalities. So we put that bug in their ear, and we'll see what they come up with. So we are very excited that our Pulaski class has finished. All 5 of the individuals finished the class skills exam. They're waiting for their testing opportunity, their testing window, and we did have an intern that taught in that class and is now being recommended to become a full-time EMS instructor for our county. So that was a big win for us to have an additional person in our catch of instructors. So that's all I have.
Okay. Let's move on. I think probation's next on our list.
Thanks. I don't really have a lot to add to the report that I read this morning. Our numbers, our supervision investigation numbers are still up, staying stable. They're still a little bit lower than they were a couple years ago, which is why we haven't filled a couple positions. We did hire 3 new probation officers a couple months ago, and they're all doing great. So we were able to get really good people on the list. So I'm happy about that. The only other thing is we're hoping to get back into jail eventually once the COVID stuff gets better to do our programming down there, our grant. So.
Question?
Yeah, Dave, how often I know we have officers that, and they should be. How often are they requalified? Do they requalify just like, a constable or sheriff or whatever?
Same
Same
sheriff's department does, yeah.
Okay. So fire is away, next on our list, they're away at training this week, so we're gonna skip this lengthy novel that they sent us until they come back next month. And we'll go over it then. I see the ADA is with us. You got anything to report? I mean, the DA, I'm sorry, I apologize. The DA is with us.
Nothing new, exceptional to report. Just a lot of cases we've been working on, cases going to trial. Most recent list we got from the judges have trials scheduled out up to, including the end of June at this point. Every couple of weeks, 7 couple trials. As an office, we're struggling a little bit to keep up with all the additional body-worn camera. The sheriff's office and the state police basically both went online after January 1st. And so for each case that goes out, again, if you've got 2 or 3 deputies or 2 or 3 troopers, whether it's 15 minutes or an hour's worth of body cam footage, the ADAs are trying to watch all of that because they're dealing with different people, different vantage points, and trying to keep track of that. It's becoming overwhelming, quite honestly. And again, we're trying to process it, pushing it out to the defense attorneys. And I guess I can talk to you afterwards a little bit, kind of get an update regarding the public defender's office. Some of the members of the defense bar are upset that it's going to a public defender's office. Then some of them have basically pulled out. A few of them have pulled out of the assigned counsel program, anticipating they're not going to be doing that later this year. So they're focusing on other parts of their practice. And so with them pulling out, it's put more work on those that are remaining. And I can tell you the ones who are remaining in the 18-week program are trying to keep up as well. But they're pulled between family court and county court. So we had a gentleman who got indicted over a month ago and has an arraignment scheduled for tomorrow because that was the first time the defense attorneys are able to show up because they have other appearances. So it is creating an impact on the system already.
Well, every time there's a change, there's always a problem.
Yeah,
We're gonna
absolutely.
work through it and figure
No,
it out.
absolutely.
Best course of action to take.
Yep, absolutely.
All right, so we'll have that conversation afterwards.
Yeah.
Okay. And Kevin, you got anything from that one?
I mean, our numbers are still way up. We're very busy. We just hired 2 people, 2 telecommunicators that are in Recruit Academy now, so assuming both of them, these are the 2 provisionals, so they have taken their exam. So assuming that they pass their exam and they're typing, then we'll be in good shape. And all in all, we ended up getting, out of the 16 people that had applied to take the exam, 10 people showed up to take it, and we have 7 positions that are open. So that doesn't bode real well for a lot of options. So hopefully we have some really good people in those 10 people that we can hire from. Another big thing that we did this past month is we actually took and scrounged up a bunch of extra leftover radios, and we've reprogrammed those to be in a training situation. So now when we're doing training over at the fire school, they're actually able to take radios and actually put them on what looks like the actual channels that when they're outside of training, they would utilize. So makes the training environment a lot more realistic. They're actually able to utilize the emergency functions, the emergency button functions, and the terminology and stuff without affecting live traffic on the system. So that was something that we added in. Spent a lot of time on radio training this past month, which is typical for this time of year, just because of fire departments not wanting to go outside and necessarily pump water and stuff. So we do radio training and stuff along that. But that's some good stuff. So I think really the only things besides next month will be very, very busy for us. We'll be starting our phone system upgrade, which is the computer system that handles all the 911 calls. So I'm doing a lot of work down at the 912 center right now to get that ready, and then our staff will be staffing that for approximately 2.5 weeks while we revamp the primary center. So,
any questions? I just like it to stay there.
Last time, you mentioned about the problems being able to entice people to come in and work at the 911 center.
Yep.
What is our, I've asked the other departments, what is our pay scale compared to other counties of similar size and similar workload?
So just recently, well, last year, I polled our neighboring counties, and I don't think it's really fair necessarily to compare us to Onondaga.
Right.
They're about $6 an hour more, but Hughes County has 2 people less per shift. They staff at 5 people per shift. We staff at 7, and Jefferson County now staffs at 6. And they're paying. We are now with the latest raise that they just got in the newest contract. We're paying starting at $18.61. Hughes County is starting at $23.41, and Jefferson County is starting at $23.32. So we're about $5 an hour less than they are to start.
The responsibility of the 911 center, communicator, I would take the job at $5 more an hour. Because I was taken back when I first originally was in here and I heard what they were paying. Okay, and I'm sorry, I just think that they're not asking. And if they're asking, they should be asking for what equal pay. They're not asking above it. They're asking for the equal pay of another county, and I agree with it. Okay, I mean the questions that they answer and the things that they go through. I mean, $5 more an hour is and I'm sorry, I would vote at least 10 times for yes on taking them up to equal to counties that are similar size and similar staffing. Okay, and that's the way I feel. I'm sorry.
Agreed.
I wish you could do something for you, but I know that they just signed their contract, so there's nothing we can do right now. But
outside of being able to negotiate some type of a reclassification to get them into a higher class, that's about as close as we could possibly offer at this point.
You might be able to look at doing something in the sense that we're still, I know that all the mask mandates and everything are being lifted, but we're still in a COVID-related situation. And maybe we could go for, until, we're going to give you, this raise on the COVID-related and use the rescue money in that sense, because as far as I'm concerned, it is rescue. Okay, so that's just my idea and my plan, and you'll probably go out the door.
Thank you for your support on that. When we go to NISAC, this is one thing that is definitely being brought up. It's not just an issue in Oswego County; it is in other counties as well. Some of our neighbors have been able to readjust and correct for that. So,
okay. Thank you.
You're welcome.
All right, any other business? Yes.
Can I just, I did ask Dave Turner about that with the American Rescue Act funding. It was in my initial proposal to have a one-time priority pay for EMS providers in the county. And he came back to me a little while ago and said that was not allowable in the latest eligibility list. So unfortunately, I had asked for it for EMS. They were on the streets through the whole thing. So unfortunately, it's not eligible anymore.
Okay, any other business? Yes, sir.
Do something else then.
Well, I think every department, whether you're in social services or there are a lot of them are underpaid compared to other counties. It's not just 911, it's not social services. Everybody, compared to Onondaga County, they're getting a lot more money. How they keep upping all the salary, I mean, it's a blanket thing in every department we got. They pay a lot more money.
That's a problem.
That's the problem.
I think we're moving on from the salary conversation.
Phil, if I remember right, and I might have forgotten because I'm old and gray and all that stuff, but wasn't there an account for a wage study? We had money put away someplace for that?
No, it's just been a discussion.
All right, how long ago was the last time you did a wage study?
First year I was employed with the county.
That was in 1910.
1990.
Before dirt.
Maybe we ought to take a good look at that then.
All right, any other business associated with public safety that wants to be discussed? Needs to be discussed. No new business? Okay, so we're not gonna end the meeting. Do I have to end the meeting, or we gotta go take a picture first? Do we end the meeting and then go take a picture?
Yeah, you can end the meeting.
Okay. You get the appropriate motion?
So moved.
All in favor? Aye.